Psilocybin, a naturally occurring psychedelic compound found in certain species of mushrooms, has gained significant attention in recent years for its potential benefits in mental wellness. Medicinal mushrooms, often revered for their therapeutic properties, represent a broader category that includes psilocybin mushrooms as well as non-psychoactive varieties like reishi and lion's mane, which are championed for their health-promoting qualities. In essence, psilocybin stands out for its psychoactive properties that can alter perception and cognition, whereas medicinal mushrooms without psychoactive effects are utilized for general health enhancement. The significance of this topic lies in the burgeoning interest in alternative mental health therapies. Psilocybin, once stigmatized as a recreational hallucinogen, is emerging as a promising tool in the treatment of depression, anxiety, and PTSD. Clinical trials show that psilocybin can facilitate profound experiences leading to lasting psychological benefits, making it a formidable candidate in therapeutic settings. On the other hand, non-psychoactive medicinal mushrooms like reishi are acclaimed for their adaptogenic properties, potentially aiding in stress reduction and immune support, and thus contributing to overall mental wellness. Real-world applications of these concepts are increasingly visible. For example, in controlled therapeutic settings, psilocybin is being used in guided sessions to help patients process deep-seated emotions and trauma. One high-profile study demonstrated its effectiveness in significantly reducing depression symptoms without the side effects typical of conventional antidepressants. Meanwhile, lion's mane is gaining popularity in the wellness industry for its potential to enhance cognitive function and neuroprotection, stimulating nerve growth factors that promote brain health. Advocates for the therapeutic use of psilocybin often emphasize its potential to revolutionize mental health care, highlighting anecdotal and empirical evidence of its efficacy. However, challenges and controversies remain, particularly around legality, safety, and the potential for misuse. Some experts caution against the non-supervised use of psilocybin due to its powerful psychoactive effects, which can lead to challenging psychological experiences if not properly managed. This topic connects deeply with the broader discourse on mental wellness, as it challenges conventional medical paradigms and opens the floor to discussions on regulatory reform and the destigmatization of psychedelics. As research progresses, the interplay between psilocybin, medicinal mushrooms, and mental wellness continues to influence holistic and integrative health approaches. Ultimately, these discussions aim to shift perspectives on mental health treatment, potentially offering more personalized and effective solutions. Understanding psilocybin, the active compound found in certain species of psychedelic mushrooms, is crucial for anyone interested in the intersection of medicinal mushrooms and mental wellness. Psilocybin is classified as a hallucinogen, and when ingested, it is metabolized into psilocin, which influences serotonin receptors in the brain. This interaction can result in altered perception, mood, and cognition, embarking users on a psychedelic journey that has been described as both transformative and therapeutic. The significance of understanding psilocybin lies in its potential applications for mental wellness. Recent studies suggest that psilocybin could offer substantial benefits in treating various mental health conditions, such as depression, anxiety, and PTSD. Its capacity to induce deep introspective experiences can help patients confront and process underlying psychological issues effectively. For instance, in clinical settings, psilocybin-assisted therapy has shown promising results in alleviating symptoms of treatment-resistant depression. Another example is its use in reducing end-of-life anxiety in terminally ill patients, providing them peace and acceptance that traditional treatments often fail to achieve. Support for psilocybin's medicinal potential is growing among researchers, mental health professionals, and even policymakers who advocate for its reconsideration as a viable therapeutic option. Proponents argue that when used responsibly and under guided supervision, psilocybin can serve as a powerful tool for psychological healing and personal growth. Yet, the path to broader acceptance and integration into medical practices is fraught with challenges and controversies. The primary concern lies in the potential for misuse and the risk of adverse psychological reactions, such as inducing anxiety or psychosis, especially in unsupervised settings. Additionally, psilocybin's classification as a Schedule I substance under federal law in many countries poses significant legal and regulatory hurdles, slowing research progress and therapeutic adoption. Despite these challenges, understanding psilocybin is intricately connected to the broader narrative of psychedelic medicine and mental wellness. It directs attention towards a shifting paradigm in mental health treatment, where the emphasis is placed on holistic and integrative approaches. By exploring the basic science and effects of psilocybin, we pave the way for informed discussions on its role in mental wellness, highlight the need for revised regulatory policies, and ultimately, bring more focus to how its potential benefits can be harnessed responsibly for improving mental health outcomes. Psilocybin, a naturally occurring psychedelic compound found in certain species of mushrooms, is gaining increasing attention for its potential therapeutic benefits in mental wellness. Defined scientifically, psilocybin interacts with serotonin receptors in the brain, particularly the 5-HT2A receptor, resulting in altered perception, mood, and cognition. This compound plays a significant role in understanding and developing treatments for a range of mental health disorders, including depression, anxiety, PTSD, and addiction. The significance of psilocybin in mental wellness cannot be understated. As mental health issues become increasingly prevalent, there is an urgent need for innovative and effective treatments. Psilocybin's potential to provide profound psychological insights and emotional relief positions it as a promising alternative or complement to traditional psychiatric medications. Notably, psilocybin-assisted therapy has been shown to produce long-lasting benefits after just a few sessions, unlike some traditional treatments, which may require prolonged use. A prominent real-world example of psilocybin's application can be seen in clinical trials exploring its effects on treatment-resistant depression. These studies, notably by institutions like Johns Hopkins University, have demonstrated significant reductions in depressive symptoms, with some participants achieving remission. Another application involves its use in managing existential distress in terminal cancer patients, improving quality of life, and reducing anxiety and depression about mortality. Support for psilocybin's therapeutic use is growing, both within the scientific community and among mental health advocates. The U.S. Food and Drug Administration has even designated psilocybin as a breakthrough therapy for depression, facilitating its research and development. Moreover, many believe that psilocybin can lead to a paradigm shift in mental health treatment, emphasizing holistic and integrative approaches that incorporate therapeutic experiences and self-exploration. However, challenges and controversies exist. The legal status of psilocybin remains a significant barrier, as it is classified as a Schedule I substance under the Controlled Substances Act in the U.S., implying high potential for abuse and no accepted medical use. Concerns about adverse psychological effects, such as anxiety or paranoia during use, also warrant cautious consideration. Skeptics highlight the need for more comprehensive research to fully understand its long-term effects and risks. Understanding the commonly asked questions about psilocybin is crucial as they touch upon broader issues of mental health treatment, societal acceptance, and drug policy reform. By exploring these questions, we can better appreciate how psilocybin intersects with and influences the discourse on medicinal mushrooms and mental wellness, potentially leading to more informed decisions and innovative therapeutic practices. Medicinal mushrooms, such as reishi, lion's mane, and cordyceps, have garnered significant attention for their potential role in supporting mental health. These fungi are rich in bioactive compounds that can influence brain function, mood regulation, and stress response. Reishi is often referred to as the mushroom of immortality and is known for its calming effects, making it beneficial for individuals dealing with anxiety or insomnia. Lion's mane, on the other hand, is praised for its neuroprotective properties, which can stimulate nerve growth and potentially enhance cognitive function. Cordyceps, commonly associated with boosting energy and vitality, can also aid in reducing fatigue and enhancing one's overall sense of well-being. The significance of medicinal mushrooms in mental health lies in their natural ability to modulate neurological processes without the harsh side effects often associated with pharmaceutical interventions. This makes them an attractive option for individuals seeking holistic or complementary treatments for conditions like depression, anxiety, and cognitive decline. For example, lion's mane has been studied for its potential to improve symptoms in people with mild cognitive impairment. Similarly, reishi's adaptogenic qualities help balance and normalize the body's responses to stress, contributing to an improved mood and reduced anxiety levels. Prominent voices in the wellness community, including naturopaths and functional medicine practitioners, support the integration of medicinal mushrooms into mental health regimens. They emphasize the importance of a balanced approach that combines traditional psychiatric treatment with alternative therapies to optimize mental wellness. However, some skeptics question the efficacy of mushrooms due to limited large-scale clinical trials, and critics argue that the placebo effect might account for some reported benefits. Challenges persist, particularly regarding the standardization and regulation of mushroom-based supplements. Variability in cultivation and extraction methods can lead to inconsistencies in potency and effectiveness. Moreover, a general lack of understanding about how these mushrooms specifically interact with brain chemistry can hinder their acceptance in mainstream medical practice. Despite these challenges, the potential of medicinal mushrooms to support mental health offers a promising avenue for further research and integration into holistic wellness practices. Their role is closely linked to the broader conversation about psilocybin, as both explore natural means of enhancing mental health. By highlighting the differences and synergies, we gain a more comprehensive understanding of how fungal therapies can contribute to mental wellness, providing hope and new options for those seeking alternative or adjunctive treatments.